Others are late. Okay. So today we will talk about the contrast enhanced ultrasound. Okay. So it is same idea. We are using a contrast agent. Okay. While performing ultrasound. So what is the principle of it? This contrast enhanced ultrasound involves administration of intravenous contrast agent containing microbubbles of perfluorocarbon or nitrogen gas. The microbubbles affect ultrasound backscatters, increase vascular contrast in a similar manner to intravenous contrast agent used in CT MRI. So we have a contrast agent. Okay, this contrast agent is formed by a microbubble. Now we will talk later on microbubble. What is it? Microbubble is a small structure that consists of a shell material and core. Okay, the core formed by a gas and the shell material different, could be lipid, polymerase, galactose. This contrast agent, which is microbubble, we will give it intravenously, mean by injection to the vein. Okay. The microbubbles affect the ultrasound backscatters, those all noise backscatters which have it will reduced, okay, and it will increase the vascular contrast in similar manner, same way which we are using in contrast agent in the other modality, which is CT and MRI. Now we are describing the microbubbles, this contrast agent which we are giving. The microbubble shell material determine how easily the microbubble is taken up by the immune system. Now we have a shell material, mean the cover, and the core. The core mean the center material. Okay, so this shell material will determine how easy the microbubble is taken up by the immune system. The material for microbubble determine its time in circulation, and elasticity also it will determine how much it will last in the circulation. Okay, how much the elasticity, how it will take by the immune system. This all determined by the shell material. Microbubble shells are composed of albumin, galactose, lipid, or polymers. I mean, all those, any one of them could be a shell material for this microbubble. It could be lipid, could be polymers, could be galactose, could be albumin. Microbubble gas core, now the core, the center material formed by a gas. Okay, so the microbubble gas core is the most important part because it's determine the ecogenicity. Now the most important part is the core material, the central material, because it will determine the ecogenicity. Okay, while the shell material determine how this microbubble will be taken by the immune system. It is a foreigner particle and also determine the time in circulation and elasticity. Size of microbubble is around 1 to 4 nanometer, means small nanometer. The microbubble is nearly around the size of RBC, as it should not cause the vascular endothelium. It is small in size, like the size of our red blood cell. Okay, it's designed to be this size, so it will not cross the vascular endothelium. Now, the most widely or available those microbubbles, those are the widely available contrast agent present in the market. Okay, you can see them. Okay, Albonex, Ecovis, Levovis, Myomap, Quantizone, Sonovio, those all are in what? Microbubbles, contrast agents, okay, and we divided them according to the core. The core, if it is air, nitrogen, so those are the widely available contrast agents. Perfluorocarbon, those are the contrast agent, and if it is silver hexafluoride, so this is the present contrast agent, microbubbles. Okay, this you don't have to remember, just look to them. Okay, you don't have to remember them. Okay, just have to look to them, that they are, what is the names of them. Okay, be familiar with it, because later on we will check the most commonly used one. Now this we have to remember it. Okay, that table, just look to it. Now this, which is the commonly used microbubble, this is, we have to remember it. So which is the most commonly used microbubble? First we have EcoVest. Okay, this used in right heart myocardium if you want to investigate the myocardium, liver, and gynecological application. We will use EcoVest. Albonex, we use it in the liver, kidney, and heart contrast imaging. And Sonovo, most commonly used in India. This most common contrast agent used in India, also in Europe. Used in study of liver, kidney, and gynecological studies. Okay, so those are the most commonly used microbubbles. You have to remember them. What is the name? Where we are using it. For example, if I mention the most common used microbubble in the right heart myocardium, so you will use EcoVest. Okay. What is the most common used microbubble in India or in Europe? You will choose what? Sonovo. Now, how we will technique for use of contrast enhanced ultrasound agents, how we will use them. We have the dose. Dose Sonovi is a kit including one vial, okay, one powder, one vial of powder, okay, containing 25 milligram of lyophilized powder, and second vial contains suspension medium, which is galactose solution. So we have two, one powder vial, one in solution to melt it, okay, like many injection we have it, powder and solution to melt it, two vial, okay. For IV use dose for Sonovi is 2.4 ml. What we will give dose 2.4 ml. How we will calculate it? 0.04 ml per kg. I mean, if we will want to calculate it according to body weight, so it is 0.04 ml per kg. Okay. Total dose is 2.4 ml. For renal and pancreatic evaluation, we will use a lower dose, which is 1 ml. And then after we will inject this contrast agent, we will take 10 ml of 0.9% normal saline. This normal saline, which is sterilized, okay, which we have it, okay, we will take 10 ml of it and we will inject it after the contrast agent, okay. So first we have two vial, one powder, one solution, okay, we will mix them, okay, then we will take 2.4 ml and inject it intravenously in the patient, okay. After it, we will take 10 ml of normal saline and we will also inject it after the microbubbles. So we'll take a normal saline, should be flushed after the administration of contrast agent. Now, what is the procedure? That was the dose. The procedure, the suspension should be administered before 15 minutes after preparation. We will prepare it for 15 minutes, then we will inject it. The target organ is focused on B mode ultrasound and then contrast specific imaging mode is turned on. As like we stated before, First, we will take a B mode image, okay, conventional ultrasound image. Then we will turn the contrast enhanced ultrasound image. On ultrasound, after the contrast is administered, the tissue is divided on the base of perfusion. Now, how we will divide the tissue? Like in conventional ultrasound, we have hypoechoic, hyperechoic, isoechoic. So here we will divide it on the base of perfusion. So what we have? Hyper-enhanced, iso-enhanced, and hypo-enhanced. On the base of what? On the base of perfusion. Mean hyper-enhanced will be having a this lesion, okay, having a hypervascularity, more vascularity than the normal tissue. Iso-enhanced mean have same perfusion, hypo-enhanced less perfusion than the normal tissue, okay? So we will divide the tissue on the base of perfusion into hyper-enhanced, iso-enhanced, and hypo-enhanced. Now we describe the dose procedure. Now we have two types of contrast agent. One is non-targeted, the first contrast enhanced ultrasound. The second is targeted contrast enhanced ultrasound. So two types of contrast agent, non-targeted and targeted enhanced ultrasound. The non-targeted is the most common method. The most common used is the non-targeted contrast enhanced ultrasound. So it is the more common method. In this, the microbubbles will remain in the systemic circulation for a certain period of time. This contrast agent will stay in the circulation for a specific time period. During that time, ultrasound waves are directed on the area of interest. Now, we are injecting intravenously contrast agent, and we will direct our sound wave into our region of interest. When microbubble in the blood flow past the imaging window, the microbubble compressible reflect a unique echo. Now, when this ultrasound wave will reach to the microbubbles, it will cause them to move, okay, vibrate, and it will generate what? An echo. Then this echo will reflect to us as description of perfusion, hyper, hypo, or iso-enhanced. Now, since the non-targeted contrast enhanced ultrasound is the most common method, okay, so what is the uses of it? To enhance the contrast at the interface between the tissue and blood, a clearer picture of structure of an organ. We will see a clear, more picture of structure or organ. Evaluating the degree of blood perfusion, evaluating the blood volume in an organ or area of interest. Then what we will see? We will see the blood perfusion in that organ or area of interest. Differentiating between benign and malignant focal liver lesion. Obviously, you know, benign lesion have less vascularity, malignant lesion have higher vascularity. So we can differentiate between the benign and malignant focal liver lesion. So we will, the uses of it, we will see a more clear picture of the structure of organ. We can evaluate the blood perfusion of that organ or structure or our area of interest, and we can differentiate between benign and malignant liver lesion. Now this is the picture of contrast enhanced ultrasound. Okay, this is our lesion, and this is after 40 seconds of administration. A, B after 90 seconds. So this is the typical appearance of liver hemangioma. This is the lesion, and it is typical for liver hemangioma. Okay, contrast enhanced ultrasound show globular bilirubin enhancement after 40 seconds. You can see it. Peripheral enhancement. This is hyper enhanced. in comparison to here, right? More bright. After peripheral enhancement, 40 seconds after microbubble injection, this is in A, okay? And progressive centripetal fill in after 90 seconds. You can see here now only this area. Now all this area is become hyper enhanced, okay? The central portion of the lesion remain unenhanced because of incomplete filling on. Just this part didn't enhance. Rest of the lesion all is enhanced. Okay, so this is an malignant liver lesion. You can see it start at the periphery enhancement, then it separate till the center. Only the center didn't enhance. Rest of it all of the lesion was hyper enhanced. I mean there is hyperperfusion. Now this is the appearance of prostate cancer at what the contrast enhanced ultrasound. This is an conventional ultrasound, okay, which is our B mode ultrasound, okay, and this is after injection of contrast, 28 seconds after injection of contrast agent. Appearance of a prostate cancer at contrast enhanced ultrasound. We have A is the baseline transrectal ultrasound of the prostate, show no focal abnormalities in the peripheral portion of the gland. You can see we can't differentiate any lesion. Okay. Now see this, you can see here there is lesion. Okay. B 28 seconds after microbubble injection, a hypervascular area is recognized in the right prostate loop. Cancer was found at biopsy. We found a hyper-enhanced area, okay, by contrast enhanced ultrasound, suspected area. So we took biopsy and we discovered there is a cancer. This is spleen, okay. Acute splenic infraction from splenic septic embolism in a patient with aortic valve prosthesis infection and bacterial endocarditis. This patient have what we say synthetic aortic valve, mean his aortic valve replaced. He was having issue with his aortic valve and they replace it, okay. So then he got a bacterial infection and then there was emboli, okay, septic emboli, which cause an splenic refraction, okay. So this is an B mode image, conventional ultrasound image A. There is no defined abnormality of the splenic parenchyma are seen on the baseline ultrasound. You can identify there is abnormality in the spleen. Okay, while in B mode ultrasound, you can see this area, dark area, I mean this is hypoenhanced. This is a normal perfusion. Okay, this parenchyma has a normal blood flow, while this has no. An effraction means the blood flow to that organ stopped, or that portion stopped. So here you can see there is no blood flow here. Okay, so in B image we can see contrast enhanced ultrasound image obtained 30 seconds after microbubble injection, show an enlarged non-perfused area, those all involving the thumb of the spleen. Here you can see a liver abscess. Here we have a lesion in the liver. Okay, lesion in the liver. After putting an contrast enhanced ultrasound, you can see there is no perfusion. I mean, this is not a malignancy. Okay, so it is a liver abscess. Okay, so that was the non-targeted enhanced ultrasound, non-targeted, okay, which we said it is the most common method. Now the other types of contrast enhanced ultrasound is what? The targeted contrast enhanced ultrasound. Contrast agent designed to bind to a specific molecule, which are then targeted at tissue expressing that substance. Mean we will make that agent, microbubble, attached to something, okay? Which is, for example, protein which produced while there is an inflammation. We will attach this microbubble, mean we will inject the microbubble to go directly to attach to that protein. Okay, not staying in the circulation. No, it will go specifically to attach to that protein. Okay, so it is targeted, mean we design this microbubble to go to attach to something, bind to a specific molecule. Microbubbles targeted with ligands that bind certain molecular markers that are expressed by the area of imaging. Specific markers, okay, that expressed by that area. Whatever we are searching, inflammatory, cancer, what we are searching, it will go and attach to that specific area. Microbubbles theoretically travel through the circulatory system, eventually finding their respective target and binding specifically. So it will not stay in the circulation, no, it will travel to reach to their specific target. So that is why we call it targeted contrast. The non-targeted, no, it was not designed to reach to something, to bind to something. No, it was staying to circulation, reaching our region of interest. It will vibrate when there will be ultrasound beam, and then it will produce echo. Here we design it to reach to a specific area, to bind to a specific molecule. So we call it targeted. Okay, now this is the gas. Okay, and here is coated microbubble. Okay, shell material, gas. Okay, we specify to bind to antibodies, specific antibodies. Okay, you can see the microbubble, it will travel till it will reach to attach to antibodies. So this is targeted. Okay, targeted enhanced ultrasound. Okay. What is the uses of this targeted enhanced ultrasound? First, you have inflammation. Contrast agent may be designed to bind to certain protein that become expressed in inflammatory disease, such as Crohn's disease, atherosclerosis, even heart attack. Mean we are suspecting Crohn's disease, okay? There is specific protein will be present in the patient who have a Crohn's disease. So we will make our contrast enhanced ultrasound, this agent, to be designed to attach or bind to that specific protein. So we call it targeted. Okay, so it is a protein expressed by some of inflammatory disease like a Crohn's disease. Thrombosis and thrombolysis. Contrast agents specifically bind to activated platelets, allow real-time molecular imaging of thrombosis. If you are suspecting a thrombosis, so we will we will make our contrast agent to be specifically activated to attach to that platelet which expressed through during thrombosis, such as in myocardial infarction, as well as monitoring success or failure of pharmacological thrombolysis, which we are giving it medication for patients who have myocardial infarction. We give them thrombolysis agent, okay, to melt the thrombus. Okay, so we will make our our contrast agent to be attached to that thrombolytic agent. Cancer, if microbubble are targeted with ligand that bind receptor like VEGF, they can non-invasively and specifically identify area of cancer. In cancer agent, when there will be some markers expressed by the cancer, okay, so we will make our microbubbles to be attached to that marker, okay, to that receptors, okay. So we will know there is cancer area because our microbubble attached to that receptor expressed by the cancer. Drug delivery, we can use our microbubbles to deliver drugs, okay. Mean we want to deliver a drug to specific area, so we will attach the drug to our microbubble, and when it would reach that area, then it would release that drug. Drug can be incorporated into the microbubble lipid shell. Gene delivery, okay, vector DNA can be conjugated to the microbubble. Also, if we want to give gene therapy, we will attach part of the DNA to the microbubble and then injected it through the intravenous, and it would reach to that area where we want it to reach. So we can deliver a gene, we can deliver a drug, we can diagnose cancer, okay, we can diagnose the thrombosis, and also can diagnose the inflammation with targeted contrast enhanced ultrasound. Now this is a focal liver lesion. You can see it here. We saw it by contrast enhanced ultrasound. Okay, this is an complex hepatic cyst. Okay, this is a B mode image. Okay, heterogeneous, we will see heterogeneous round lesion with a well-defined margin, but no defined posterior enhancement. Okay, this we give contrast agent, and after 60 seconds we took the image. After microbubble injection, the lesion doesn't enhance in all vascular phases. You can see there is no enhancement, so it is not malignancy. Prostate cancer. Here by remote ultrasound image, you can see you can't identify a lesion, while this is here a hyper enhanced lesion. Hyper enhanced, more perfusion, more blood vessel. Drug delivery, okay. Now we attach the drug to microbubble. When it reached, okay, we make them vibrate and we deliver a drug to this region, okay. Now this contrast agent, like we have contrast agent in CT MRI, contrast agent maybe have what? An adverse reaction. Adverse reaction. So we have the adverse reaction here, could be systemic, could be cardiovascular, digestive, musculoskeletal and central nervous system, respiratory or skin, or special cells. Okay? Any of those can have an adverse reaction, side effect of the contrast agent. Frequency of this side effect could be 0.5 of till 5%, could be less than 1%. Okay, so now we will divide the reaction to high frequency, which could reach till 5%, and less frequent, which is less than 1%. Okay, now we will say our systemic side effect. If it is high frequency, so it could be headache, hypersensitivity. If it is less frequency, it is abdominal pain, weakness, chest pain, and back pain. Okay. Cardiovascular, high frequency side effect is hypertension, while less frequent side effect is atrial fibrillation, palpitation, and tachycardia. In digestive system, the higher frequency is nausea, while lesser frequency is anorexia, diarrhea, and dyspepsia. Dyspepsia means difficulty, you are feeling difficulty in swallowing. Anorexia means less appetite. You are not feeling to eat. Okay. Musculoskeletal ultrasound and central nervous system, dizziness, dry mouth, and vasodilatation as high frequency side effect, while the lesser frequency side effect is leg cramps and paresthesia. You are feeling numbness in the limbs. Respiratory and skin, there is no high frequency side effect, but there is less frequency side effect, which is dyspnea, sweating, rash, and pruritus. Pruritus means itching. Special sense, we have high frequency side effect is altered taste and smell. There is no less frequency. Okay, so we divided the side effect into highly occurring, which is higher frequency, 0.5 to 5%, and this of less frequency, less than 1%. Okay, the high frequent, according to the system, it could be cardiovascular, digestive, musculoskeletal, or central, respiratory, and special sense. And also we divided the less frequency according also to the systems. Okay, so this is a side effect can happen with the what? With the contrast agent. Now we have 1 minute only left for the lecture. Okay, if there will be time, so you try to rejoin. How to reduce the risk and management? To reduce the risk, we will check for intolerance for any of the component of the contrast agent. We will check the patient have any allergy or intolerance to any of the content of this contrast agent. Use the lowest level of acoustic output and shortest scanning time to allow a diagnostic examination. Okay, management of a drug reaction is symptomatic. If there will be any drug reaction, so we'll manage it symptomatic. We will try to reduce our scanning time as much as possible. Okay, and we will use lowest level of acoustic output, because with high acoustic output, this microbubbles will blast. Okay, so we will use our lowest level of acoustic output and shortening the scanning time, and we will manage about how to reduce the risk and to manage the side effect of contrast agent. To reduce the risk, check for intolerance of any of the component of the contrast agent. If we have to check before injection of contrast agent if the patient have allergy to any of the component of the contrast agent. Use the lowest level of acoustic output and shortest scanning time to allow a diagnostic examination. We said at a higher acoustic output, the microbubble will blast first. And third, management of a drug reaction is symptomatic. Then, according to that, if there is a side effect, which we said we differentiated, we said there is high frequency, low frequency. So we will give drug management according to that side effect. Now, what is the advantage of contrast enhanced ultrasound? Acoustically homogeneous blood and surrounding tissue have similar echogenesis, so it is also difficult to clearly discern the degree of blood flow, perfusion, or the interface between the tissue and blood using traditional ultrasound. By traditional ultrasound, the blood and the tissue have same echogenicity. Okay, so we can't differentiate properly. Okay, with and conventional ultrasound, while in contrast enhanced ultrasound, since it depends on the level of perfusion, so we know there is a hyper enhanced, iso, and hypo enhanced. Allows real-time evaluation of a blood flow. You can see in front of you, this organ is hyperperfused, less, or isoperfused. Destruction of microbubble by ultrasound in the image plane allow absolute quantification of tissue perfusion. We can see the amount of tissue perfusion of the organ. It doesn't involve radiation, as it is an ultrasound with contrast, mean it is not a CT or MRI. Okay, so it is not involving radiation like CT. Very cost efficient and widely available, not here, outside it is, and not costly. okay, and it is widely available outside. Since microbubble can generate such strong signal, a lower intravenous dosage is needed. Micrograms of microbubble are needed compared or milligrams for other molecular imaging modalities such as MRI, contrast agents. So the ultrasound with contrast generate such a strong signal that we don't need much amount of contrast agent, like we amount of contrast agent which we needed in CT or MRI. Okay, we are using just a micrograms here, while we need a milligrams with other molecular imaging. That was the advantage of it. Okay, we need less amount of contrast agent. It is very cost effective and widely used. Okay, it doesn't involve any radiation. It will show us the absolute quantification of tissue in real time and easily differentiate the blood from the other structure. Now, what is the disadvantage of contrast enhanced ultrasound? Microbubble don't last very long in circulation, have a specific time in the circulation. When we mentioned, we said the shell material of microbubble will determine its presence in the circulation. So it is not lasting for long. It have a specific lifetime. They have low circulation residence time because they either get taken by the immune system cells or get taken up by the liver or spleen even when they are coated with prostaglandin. So it have, even when it's coated with polymerase, okay, still it will be either taken by the immune system or the liver and spleen. Ultrasound produce more heat as the frequency increase, so required monitoring. Okay, microbubble burst at low ultrasound frequency, high mechanical indices. We said at a high mechanical output, it will burst, which is the measure of acoustic power output of the ultrasound imaging system. Increasing MI, increase image quality. This acoustic mechanical indices, if we will increase it in the machine, it will increase image quality, but it will burst the microbubble. Okay. So increasing MI increase image quality, but there are trade-offs with microbubble destruction. Microbubble destruction could cause local microvascular rupture and hemolysis. So we don't want microbubble to be ruptured and there will be hemolysis. Okay. So we are not increasing MI, okay, the mechanical indices, although it will give us a better image quality. And we are trying to reduce the scanning time. Targeted ligand, those molecule which will bind to the microbubbles. We said microbubbles, sometimes we can bind it to some molecule to deliver either a drug, gene, or whatever. So this targeting ligand can be immunogenic, mean it will aggravate or the immune system. So this ligand can be immunogenic since current targeting ligands used in preclinical experiment derived from animal culture. Those ligands are derived from animal culture, so it can aggravate our immune system. Low targeting microbubble adhesion efficiency. This is main reason that target contrast enhanced ultrasound remain in the preclinical development stage. Okay, there is a low adhesion between the target, this carrying material, the ligand, and the microbubble. So that is why the targeted type of contrast agent is still in the preclinical development, mean they didn't try it on the human yet. We are using all the non-targeted contrast ultrasound. Okay, that is all the targeted and its uses which we mentioned. It is in the animal yet, in the animal trial. They didn't try it on the human yet because of many issues. We said it could be immunogenic. Okay, this low adhesion, mean this adhesion between the microbubble and the ligand could be of low quality, so it can be affect the human being. So that is why it is under preclinical trial. It didn't reach to the human.